To oral questions put by members to ministers. The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. My question is for the Premier. Nova Scotia's economy and healthcare system face a looming new threat, and that is the massive tax increase that the federal government is considering imposing on the small businesses of Nova Scotia. Now 40 small business organizations have come together and formed the Nova Scotia Coalition for Small Business Fairness and have written to the Premier asking to defend them. They asked him specifically to stand up for Nova Scotia's small business and insist the federal finance minister take these proposals off the table. And I will table that letter, Mr. Speaker, and ask the Premier what is he doing to stand up for Nova Scotia's small businesses and take those proposals off the table.
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the honourable member for the question. As the honourable member will know, I would have met with the Minister of Finance last week, expressed to him the many challenges associated with tax changes that could impact the province of Nova Scotia. He assured me he's out listening to Canadians today. Continue to do so. I encourage the honourable member and all members of this House to voice their opinion to the federal finance minister as he's going out listening to Canadians to ensure that their views are being heard by him, as well as the views that I articulated to him on behalf of not just healthcare providers but small business owners across this province who require capital to be left in their corporation, whether it's to deal with a downturn in the particular sector they're in, or quite frankly allowing them to invest in startup community in our province.
Honourable Leader of the Official Opposition on his first supplementary.
Mr. Speaker, quite frankly, that is not good enough. Passing on their concerns is not enough. The federal government has a website to allow people to pass on their concerns. The small businesses of Nova Scotia have asked the Premier to actively oppose these changes and stop them in their tracks. And they're not the only ones, Mr. Speaker. Hundreds of doctors came together in Halifax this past weekend to oppose the changes. They released a survey. 451 doctors will consider leaving Nova Scotia if these tax increases go through. 375 more doctors will consider reducing their hours of work if these tax increases go through, Mr. Speaker. They don't want a Premier to merely pass on their concerns. They want a Premier and a government to stand up and publicly oppose them. So I'll ask the Premier, on behalf of the doctors and their patients, the small businesses and their employees, does he personally and his government oppose these changes, and will he communicate his opposition to the Prime Minister and the Finance Minister in Ottawa?
The Honourable Premier.
Mr. Speaker, I want to tell the honourable member I have communicated the concerns that Nova Scotians have and the concerns that our government have directly to the federal government.
The Honourable Leader of the Official Opposition.
Mr. Speaker, today on the Health Authority website there are 150 vacant positions. The Health Authority looking for doctors to fill these vacancies across the province. I'll table the list of vacancies, Mr. Speaker. This is not a matter where we just pass on the concerns that small businesses and doctors have, Mr. Speaker. Our healthcare system is at risk. Our small business sector is at risk. Will the Premier do more than pass on their concerns and stand in his place and tell the people of Nova Scotia publicly that he is against these changes and he'll do what he can to stop them?
The Honourable Premier.
Mr. Speaker, again, I want to tell the honourable member I've heard from Nova Scotians continue to make sure that the federal government understands the impact of these changes on the economy of our province, from whether it's attracting, retaining healthcare providers or the investment in small business across the province. What I can tell you, Mr. Speaker, what it isn't, and what the honourable members in this House shouldn't do at every opportunity is just fearmonger across our province, looking for a microphone to stand up to express their displeasure. Mr. Speaker, always looking for a political angle into every issue that's inside of our province. The election,
the Honourable Premier has the floor.
Speaker, I want to remind the honourable members that the election is over. Perhaps they might want to start working for Nova Scotians.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, in the 2013 provincial election, the Liberals promised to provide up to $120,000 in tuition relief to 25 new doctors per year for 4 years in exchange for a 5-year commitment to practice in underserviced communities. As of December 15, only 12 doctors had enrolled in the program, and there's been no further information on uptake of the program since. Now, yesterday, the Finance Minister tabled a budget that extended this tuition relief scheme, so I'd like to ask the Premier, why he thinks this program is going to be successful now when it wasn't in the past.
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable Member for the question. It is one way for the province to be able to ensure that healthcare providers see an opportunity to work across the province, a chance for us to reduce the cost of medical school and the costs associated with the extensive education that's required for a medical degree. It's part of the many options. As you would know, there's a rural residency program which also provides an opportunity for people to be out in rural communities. We broadened the scope and around that program. The Honourable Member may know at the very beginning that was dedicated to certain targeted areas. That many of them are rural communities. That is also now an urban issue that same program will be available to, and we look forward to continuing to work with our healthcare providers.
The Honourable Leader of the New Democratic Party on his first supplementary.
Mr. Speaker, the matter of the rural residency program is in fact germane to the point that I'm trying to drive across. While I'm sure the Premier is excited about the initiative announced yesterday to welcome new medical residents to the province, with all due respect, our citizens need doctors now, not in the year or two that such a program envisages. Family practice doctors generally begin their residencies in July, but they interview for those positions usually as early as October, and this means that this plan stands to not yield any family medicine residents in the province until 2019. So I want to ask the Premier, does he think that people currently without a doctor can really wait for 2 years?
The Honourable Premier.
Mr. Speaker, again, I want to thank the Honourable Member for the question and continue to ensure that we provide many options for healthcare providers to work in this province, flexibility that they've asked for. We're providing that at the same time. This tuition relief program that is made available to some physicians who want to take advantage of that opportunity. We're happy that some have. We're looking forward as we broaden the context where it can be those in the urban center that can also do that there will be a greater pickup on that program. The issue of the rural residency program is a positive one, Mr. Speaker, that we're seeing some positive results. As he would know, the issue that he refers to is not unique to Nova Scotia. It's across the country. And if the government, the former government of the NDP had actually had a forward-thinking, long-term view of how we deliver health services to the people of Nova Scotia, we would be in a very different circumstances.
The Honourable Leader of the New Democratic Party on his final supplementary.
Mr. Speaker, further to the same line of difficulties, in the summer of 2016, the Health Minister announced a new locum program to address the doctor shortage, and this was a program to specifically target rural communities. The program would send physicians on a year-long tour of the province doing short-term stints in underserved areas, and the idea was, of course, that physicians would ultimately decide, some of them, to stay and practice in rural communities. But by May of this year, 11 months after that initial announcement, only 2 people had signed on to this program, which had 8 spaces available and it needed 4 to be able to operate. So I think it is fair in this respect too to ask the Premier if, in his view, this program has been a success as far as addressing this great crisis of recruiting and retraining doctors.
The Honourable Premier.
Mr. Speaker, I would say that those communities that are receiving the services from those physicians who joined the program would think it was a success, Mr. Speaker. It's one of the many ways that we continue to work with our healthcare providers to provide initiatives to keep them in this province, continue to work for. If we were to follow the logic of the Leader of the Democratic Party, we would be absolutely paralyzed in this province, just like they were when they were in government, and then we would do nothing. In actual fact, we're out there working with communities to provide many alternatives and many options to attract people and retain them in our communities.
The Honourable Leader of the Official Opposition.
Mr. Speaker, the Canadian Federation of Independent Business recently surveyed its 3,000 members, and 52% of them said the biggest issue they have is the high taxes and the high regulatory costs that they face trying to employ their fellow Nova Scotians, Mr. Speaker, that these taxes and regulations hold us back. Maybe the Premier thinks that the 3,000 members of the CFIB are being too negative, Mr. Speaker, but they're the ones that employ 70% of our fellow Nova Scotians, and they want a Premier that takes a stand against the massive tax increases that are coming their way from Ottawa. So I will ask the Premier, why won't he take a public stance in opposition, as the small business of Nova Scotia are calling on him to do?
The Honourable Premier.
Speaker, I want to thank the honourable member for his question again. I want to remind the honourable member we took their concerns and we've taken their concerns to Ottawa. We'll continue to do so. I also want to remind the honourable member in the budget that was just introduced, there's a $14 million tax cut for small business practices. I also want to remind the honourable member that the CFIB recognized this province 2 years in a row as leading the country in reducing red tape, Mr. Speaker. Mr. Speaker, and it's exactly why we're seeing the private sector lead and grow this economy.
The Honourable Leader of the Official Opposition.
Mr. Speaker, I wish we had a Premier that knew that our economy is the slowest growing in the country, that our small businesses are speaking up and saying they can't handle more higher taxes. He forgot to remind everybody that they're about to face a cap-and-trade carbon tax increase that's also coming their way, and now he won't stand up for them and oppose the small business tax increase that's coming from Ottawa and the job losses that will go with it. But I would like to know if the Premier knows how many jobs are going to be lost. Has his government studied the impact in job losses that those tax increases are going to have, and if so, will he release that study so Nova Scotians can see for themselves?
The Honourable Premier.
The honourable member's part, he said the proposed increases, we're continuing to make sure, Mr. Speaker, the Nova Scotia small business owners, healthcare providers' views are being heard so that, Mr. Speaker, when the public consultation takes place, is finished, the federal government has a full understanding of the impact this will happen in the province. But what I can tell you what is real, Mr. Speaker, is the fact that $14 million in tax reductions for small business owners in Nova Scotia is in this current budget, Mr. Speaker. But I can also tell you, Mr. Speaker, what is real, the CFIB has recognized this province and the entire federation is leading in the reduction of red tape, Mr. Speaker. That's what I can tell you, Mr. Speaker. Those are factual, Mr. Speaker, not some kind of make-believe hypothetical position that the honourable member wants to strike fear across our province.
The honourable member for Cape Breton Centre.
Mr. Speaker, on September 15th, Cape Breton Regional Municipality Mayor Cecil Clark wrote to Minister Delory regarding an outstanding receivable of more than $2 million. I'll table that. In the letter, Mayor Clark notes that the amount owed represents 11% of the Cape Breton Regional Municipality's outstanding taxes. As I'm sure the Health Minister is aware, having previously served as the Finance Minister for several years, municipalities depend on those revenues to ensure that their citizens have an adequate standard of service. Mr. Speaker, does the Health Minister think it's acceptable that the Nova Scotia Health Authority has withheld these funds from the Cape Breton Regional Municipality?
Just like to remind the honourable member not to refer to other members of this House by their proper name. The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for raising this question. As noted and was tabled, correspondence came in just over a week ago, Mr. Speaker, from the Mayor raising some concerns with respect to a billing dispute between the NSHA and the municipality, Mr. Speaker. My understanding from the information provided is this is a long-standing situation that predates the amalgamation of the health authorities and actually dates back to the former Cape Breton Health Authority. So, Mr. Speaker, this is a situation I'm working with these organizations to help come to resolution. I'm quite confident we will do so.
The honourable member for Cape Breton Centre.
This question is directed to the Minister of Municipal Affairs. Mr. Speaker, it seems to me that this is an issue particular to Cape Breton. If the Health Authority had failed to remit payments to other municipalities, I'm sure we'd be hearing about it. In this letter to the Health Minister, on which the Minister of Municipal Affairs was also copied, Mr. Clark noted that Halifax received similar payments, which are charged to the NSHA based on powers granted by Section 79 and 80 of the Municipal Government Act. Mr. Speaker, I'd like to ask the Minister for Municipal Affairs if he thinks it is appropriate that the Health Authority meet its financial obligations to other municipalities, but not to Cape Breton.
The Honourable Minister of Municipal Affairs.
Thank you, Mr. Speaker. I'd like to thank the honourable member for the question as well. We received that copy of correspondence approximately a week ago. We're gathering information in our office. I relayed that information, of course, to the Minister of Health, and I'm confident as the Minister of Health that we can work through this process, and we'll continue to work with the Department of Health to come to a solution.
The Honourable Leader of the Official Opposition.
Mr. Speaker, the Premier referred to the federal tax increases as hypothetical, but the threat to this province in healthcare and in our small businesses is very real, and that's why they are speaking up, Mr. Speaker. The Ottawa Liberals are even going after our farmers, Mr. Speaker. It's become clear that if these changes go through, it will be more expensive to pass on your family farm to your son or daughter than to a multinational corporation. Well, that is simply wrong, Mr. Speaker. So we are very clear. We are opposed to these changes. We'll do everything we can to stop them. What's hypothetical is, does the Premier actually oppose them or not? So I'd like to ask the Premier, for the farmers of Nova Scotia, will he take a strong stand in opposition to the federal tax increases, yes or no?
The Honourable Premier.
I want to thank the gentleman for the question. I continually, each and every day, stand with the farmers that I represent, Mr. Speaker, in this House and across our province. I am grateful for the continued work they do, providing opportunity and employment for young citizens in my constituency and across this province. We'll continue to do, make sure that the policies of our government and the government are fair to all sectors across the province. At the same time, we'll ensure that the views and values of the business people in this community are understood by the federal government when it comes to any changes they may have into the future and the impact it will have on our economy and our sectors.
The Honourable Leader of the Official Opposition.
Mr. Speaker, the only group that the Premier is clearly standing with is the Liberal Party in Ottawa. Not the farmers, not the small businesses, not the doctors. They're all wondering where he stands. He has passed on their concerns, and I think they all know how that went. He passed on their concerns, but don't worry, I won't say anything publicly to embarrass fellow Liberals. That's the problem, Mr. Speaker. The Premier has a choice to make. He can stand with the farmers, he can stand with the small businesses, he can stand with the doctors and tell them he will publicly oppose those changes, or he can stand with the Liberal Party of Ottawa. Which is it, Premier?
The Honourable Premier.
Thank you, Mr. Speaker. Again, I want to thank the Honourable Member for the question. Continue to encourage him to make his views known, continue to pass those on. I can tell you we will continue to make sure that the federal government fully understands the impact of these changes and what we believe they will be on the economy of the province, making sure that the Finance Minister, as he's traveling across the country, listening to Canadians, he said he's still listening. We believe there's an opportunity to continue to shape those changes as they come out. And we're going to continue to make sure that the views and values of the hard-working men and women of Nova Scotia are understood by the federal government and the impact we believe these changes will have on them.
The Honourable Member for Pictou East.
Thank you, Mr. Speaker. Questions for the Minister of Education. In April this year, this government announced that pre-primary was going to cost $3.7 million in the first year. In July, media reports tagged the cost at $4.1. On Monday, the cost was reported as $6.5. And then yesterday, the Minister of Finance said the cost was $4.45. My question for the Minister of Education is a multiple choice question. Can you tell this House which of these figures accurately reflects the cost in the first year?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. The highest one. And the reason for that is, Mr. Speaker, and why that number has moved is because there's more demand for this program than we thought. So we're proud to invest in our kids. Unlike the member opposite, Mr. Speaker, who said on the public record today that him and his Tory government would scrap this program. I'll remind that member, out of the 818 children that are now registered, there's 250 in every single riding of that Conservative caucus, Mr. Speaker. I wonder if he's actually going to stand with our kids or this ridiculous political position.
The Honourable Member for Pictou East.
Speaking of ridiculous, Mr. Speaker, we have a government that launched a program completely unprepared to launch, didn't have people to staff it, didn't have space. They're still rolling out a couple days at a time, not ready to roll it out.
Order, please.
The Minister...
Order, please. The Honourable Member for Pictou East.
The Minister can't say that this government could deliver that service better. The Minister can't say that this government could deliver that service more cost-effectively, but yet it doesn't matter. Rush, 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 no plan, just drive it through. That's what we see for this government all the time. So can the Minister tell us if the $6 million, which I believe was the higher one, is that for 10 months and is that for 52 classes, or are you changing all those numbers at the same time?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. The member's correct. We were ambitious with the delivery of this program because we wanted 818 kids, 4-year-olds, who we know will be supported by this program. We wanted those families who will receive this program for free to have access to this. Mr. Speaker, if we had listened to the calls of the opposition to delay, those kids would not have had this opportunity, Mr. Speaker, and to me, that is unacceptable.
The Honourable Member for Pictou East.
I think, Mr. Speaker, the question is, of the 818, would they have all not have it? I asked that question this morning because some of them were already in a registered program. It's unreal the lack of information they have. Today at the Public Accounts Committee, I asked staff from the department a very simple question. I asked if they could provide the cost per student per day for the pre-primary versus what's happening in the private sector. And they did come back with an answer eventually. They said $32 per day in pre-primary versus $33 per day in the private sector. Now, this sounds close, doesn't it, Mr. Speaker? But it's not, because the pre-primary is for much fewer hours in the course of a day. So it's not near the same. Can the minister explain how the current plan for pre-primary offers any value to the taxpayers of this province?
The Honourable Minister of Education.
Thank you, Mr. Speaker. I do want to thank the member for making the position of every single Conservative in this House clear. They are against a universally accessible, free pre-primary program for our kids and our families.
Order,
here's
please.
the difference, Mr. Speaker.
The Honourable Minister of Education has the floor.
Mr. Speaker, here's the difference. Right now, we have 384 private, not-for-profit, subsidized providers giving this service. There is only the capacity to take on approximately 25% of our preschool-age children. That includes 4-year-olds. Mr. Speaker, we don't believe that's acceptable. We know this program will have a life-changing impact on the lives of many. We know it's important for the budgets of our families, and we do not think that 1 out of every 4 kids accessing this is enough. We want 100% accessibility from one end of the province to the other.
The Honourable Member for Pictou East.
Mr. Speaker, I can tell you what we're against. We're against the bumbling of every single project that this government tries to take on. If we want to talk about accessible, let's talk about busing. How do we get to kids there? Let's talk about people having to leave their jobs to pick their kids up in the middle of the afternoon. So what? They can take them to an after-school program, Mr. Speaker, and then go back to work? Let's have a real discussion about accessibility, because using the department's own figures of $33 a day at $195 school days, we would be saving families roughly $6,400. But on April 27th, the then Finance Minister said it would save families $10,000.
Order, please. The Honourable Member for Pictou East has the floor.
Mr. Speaker, the question is, can the minister tell this House where they came up with the savings of $10,000 a family? It's not even near close, Mr. Speaker. I'd love to hear the minister say where he got that number.
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. Here's what we know. Only 1/4 of our children are accessing these programs in our province. There's only the capacity in the regulated sector for 1/4 of our children to access these programs.
Order, please. The Honourable Minister of Education has the floor.
Mr. Speaker, when families access these programs to the regulated child care sector, it also is at a high cost to them, Mr. Speaker, which is another barrier, a financial barrier on top of the geographical barrier that our families have, Mr. Speaker.
The Honourable Minister of Education has the floor.
These are very real barriers that our families have, Mr. Speaker. Costs and geographical accessibility. That is not acceptable to this government. We are going to forge ahead as we have, thoughtfully, execute effectively as we had to continue this program so that every single one of our families who choose has access to a pre-primary program which we know based on evidence, on research, on science, will have a positive impact on the lives of every one of those, particularly those in need.
The Honourable Member for Dartmouth South.
This question is for the Minister of Education. Shifting the focus to teachers, Mr. Speaker. Earlier this month, the Halifax Regional School Board sent out an email explaining that despite many efforts, including national advertising and increased screening opportunities, the board still had unfilled French immersion and core French positions for this school year. This week, families at Cole Harbour High School received a voicemail message asking parents to help in recruitment efforts to find a drama and a band teacher. Maybe the government will set up a hotline for students, Mr. Speaker, who don't have teachers, so that they can add their name to a waiting list. an approach that hasn't worked so well with family doctors. Mr. Speaker, we're already a month into the school year. Is the Minister of Education concerned about the shortage of teachers in this province?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. So to be specific, there's one board, the CSAP, that has had a challenge recruiting French-speaking teachers. So we are working with them. There's an ability through the Education Act for them to reach out to folks who don't necessarily have a BEd to fill those positions for the time being. It's an issue that is specific to that one board, and we are working with them to help them address it, Mr. Speaker. But I had a wonderful call earlier this year from the chair of our school board who said, this is the first time since I've been around that we are actually, while enrollment is going down, hiring more teachers in our education system, Mr. Speaker, and that is because the increased investment that this Premier and the former Minister of Education have made year after year to hire more teachers.
The Honourable Member for Dartmouth South.
Thank you, Mr. Speaker. For clarification, I don't think drama and band are the CSAP issues we were talking about. But moving on, perhaps this government thought that legislating a contract on teachers would make all their problems go away. A recent OECD report points out that enforced pay freezes and cuts have a shockingly obvious negative impact on teacher supply and morale, something that anyone who has spoken to a teacher in the past 6 months would know. And I'll table that report. Mr. Speaker, will the minister admit that his government's refusal to listen and negotiate a fair contract with teachers is responsible for the current shortage?
The Honourable Minister of Education.
Mr. Speaker, we are the first government in 20 years that have actually hired more teachers into the system, Mr. Speaker, during periods of enrollment decline. That is because education has always been a focus for us. I remember when the NDP was in government and slashing $65 million out of the system to pay for labour peace in this province, Mr. Speaker. And you know what I heard from teachers then? Enough is enough, Mr. Speaker. We finally have a government that's moving forward with them, and we are going to keep achieving all we can for our kids.
The Honourable Member for Pictou West.
Thank you, Mr. Speaker. In June, the Minister of Finance told media that it's time for Nova Scotians to have their say on how the province should handle the legalization of marijuana, and I will table that. However, she wasn't able to say if the consultation would be through meetings or, like Newfoundland and Labrador, through online surveys, which I would definitely disagree with. Also in June, the Minister told reporters she hoped the consultation would start in late summer or early fall. Is the Minister any closer than she was 3 months ago to letting Nova Scotians know how and when they can have their say? And if so, can she state the dates and locations? Thank you.
The Honourable Minister of Education. Or pardon me, the Honourable Minister of Finance. Old habit.
Thank you. And to the member opposite, what she's saying is true. I was invited to go to meet with the Ministers of Finance in June, and at that time they were talking about the steps that would have to be taken. Part of those steps included consultation. I came back and indicated that this province would be engaged in consultation. The lead on this file is the Minister of Justice. I'll ask him to finish the conversation.
The Honourable Minister of Justice.
Thank you, Mr. Speaker, and thank my colleague for the question. The whole issue of legalization of cannabis is a very complex issue. We've had a number of discussions, Mr. Speaker, and we have expended significant resources into the work required, and I look forward to public consultation in the very near future.
The Honourable Member for Pictou West.
Thank you very much, Mr. Speaker, and I appreciate the answers. However, this is a huge, huge social justice and moral issue in our society, and there's a lot of decisions just yet to be made. Public education, what age, retail locations, prevention and harm reduction, how much money investment will go into that, enforcement. These are all issues that must be addressed, and the reality is that all the other provinces are ahead of us. Even yesterday, we had the Minister of Finance indicate we want to be ready by 2018, but it wasn't very convincing that we would be. So I want to know if either of the ministers can ensure Nova Scotians that they will have confidence that these issues around retailing and public safety will be addressed by this government when there's little action to be taken on this important issue to date.
The Honourable Minister of Justice.
Thank you, Mr. Speaker, and I want to reiterate and concur with my colleague as to how important this issue is. But, Mr. Speaker, this government, like we have with past legislation, will take the time to ensure that it's done right. We have...
Order, please. The Honourable Minister of Justice.
We have expended significant resources, Mr. Speaker, on this subject, engaging other provinces. This is not a race with other provinces, Mr. Speaker. This is about informed decision-making. There's criteria laid out by the federal government. We as a province are working towards those objectives, Mr. Speaker, and at the first opportunity in the very near future, we will start our public consultation.
The Honourable Member for Pictou East.
Thank you, Mr. Speaker. My question is also for the Minister of Justice, and I guess we've found the one issue that this government wants to take their time on and try to get right. And I'm glad this is the issue because the Premier has said that the government wants to have a uniform approach and an Atlantic Canada model when it comes to the imminent legalization of marijuana. And that's a nice sentiment, but the months are moving by, and we've seen almost nothing from this government on regulation, distribution, enforcement, even consultations. We heard the minister say maybe we'll get to consultations soon. There is a deadline. It's July 1st, 2018, Mr. Speaker. Meanwhile, New Brunswick has established a Crown Corp. PEI has indicated standalone stores will be the likely distribution. So I'd like to ask the minister, can the minister explain what happened to the Atlantic Canada model, and why is this government content to lead from behind on
the Honourable
issue?
Minister of Justice.
Thank you, Mr. Speaker, and I thank my colleague for the question. One of the objectives of this government is public safety. Public safety is important, Mr. Speaker, for our youth and our adult population. What other provinces have done may not necessarily be in the best interest of public safety. We will take our time, Mr. Speaker, to get this right. We will be informed, Mr. Speaker, by the work of other provinces. And the fact that other provinces are already out the door, Mr. Speaker, does not reflect that Nova Scotia is behind. We are making informed decisions. They will be based on the evidence that we have available, and they will be in the best interest of Nova Scotians.
The Honourable Member for Pictou East.
Thank you, Mr. Speaker. It might be interesting for the House to hear which provinces the minister thinks has it wrong in what they're trying to do. At least we'd have some information. But there's a number of provinces that have asked the federal government for an extension on the July 1st deadline. We know July 1st is not that far away, Mr. Speaker, and we heard yesterday there was nothing in this budget that was tabled for training of law enforcement officers. So if it's not before March, I presume it's going to be in May, June, and guess what? We're legalized on July 1st. So there is a clock that's ticking. Some provinces are asking for an extension, and there's an opportunity for this government as well to ask something of Ottawa on behalf of its people. So I'd like to ask the minister, would he commit to asking the federal government for an extension of the July 1st deadline?
Honourable Premier.
Thank you, Mr. Speaker. I want to inform the honourable member that when Canada's premiers met in the summertime, there were 5 questions that were sent to Ottawa around this whole issue of legalization of marijuana. Those were waiting in November to have those, the answers back to those important pieces, that responsibility that we believe falls with the federal government. But I want to clarify something, the honourable member. It was the entire Federation that has talked to the federal government about the implementation date of July 1st. While he might like to look at this and try to divide an issue, this is a very serious issue that's coming, and a product that is coming out into this country. And we're going to make sure that when the regulations are put up for this province, we'll make sure that they're the appropriate ones for Nova Scotians. At the same time, we'll work with our colleagues across the country who are also experiencing the same challenges that we are.
The Honourable Member for Victoria the Lakes.
Thank you, Mr. Speaker. Mr. Speaker, my question through you is to the Minister of Health. Doctor shortages are the norm in this province, and especially in Cape Breton. As an example, the Victoria County Memorial Hospital in Bedeque recently lost a wonderful doctor with the retirement of Dr. Carlisle Chow, and the recruitment committee is trying their very best to attract a doctor to the area. The municipality of Victoria County is doing their part and has invested funds in the 2 hospitals in the county to make them more attractive for recruitment. So my question to the Minister is, what is being done by the Health Department and the Nova Scotia Health Authority to assist in this search?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member opposite for the question. As we all know, Mr. Speaker, needs of the people of Nova Scotia and indeed a need across the country, Mr. Speaker, provinces across the country, to have access to a primary care services is changing, the challenges before them. As far as the recruitment, Mr. Speaker, earlier today, the Leader of the Official Opposition tabled a list of postings for positions across the province, which is part of the recruitment process, Mr. Speaker. Many of those postings, let the member and all the members of the House know, are not just for current vacancies, Mr. Speaker, but rather part of the planning process for upcoming vacancies. So this is part of the planning and the recruitment in advance so that we have positions filled before they become vacant.
The honourable member for Victoria and the Lakes.
Mr. Speaker, one of the roles of the Health Department and the Health Authority should be to assist in all possible ways to ensure the areas recruit a doctor. Buchanan Memorial Hospital, Niels Harbour, have recently lost a doctor to moving to another area. They're left with one full-time doctor and two 50% doctors who both could retire. Letters from the Friends of Buchanan Memorial and myself requesting help have been sent to the Minister, and the needs of the communities served by Buchanan still exist. My question to the Minister is, what is the timeline for providing a full complement of doctors to ensure they'll be in place in both Badek and Niels Harbour hospitals immediately?
The Honourable Minister of Health.
Thank you, Mr. Speaker. To thank the member for the question. Again, the process of recruiting, Mr. Speaker, as you know, the NSHA and the work that they were doing, they heard from physicians across the province that the approach that they were taking, where they were trying to identify those communities that had the most acute needs for family practitioners, was not an acceptable means or approach to recruiting and finding physicians for communities, Mr. Speaker. That the physicians themselves and indeed communities and people across the province agreed that providing some flexibility for physicians to identify where they want to practice, Mr. Speaker. So it's a little challenging to point to a particular community and say when a particular vacancy is going to be filled, Mr. Speaker, because we do rely on physicians, Mr. Speaker, to identify those communities to go participate as well. Thank you.
Honourable member for Dartmouth South.
Mr. Speaker, this question is for the Minister of Education. Mr. Speaker, when it comes to early childhood education, I absolutely support significant investment in high-quality, universal childcare system. It's one of the priorities I and we all over here were very proud to campaign on. The Minister has frequently quoted the statistic that only 25% of children in Nova Scotia utilize or have access to regulated childcare programs. Mr. Speaker, that's 25% of all children, birth to age 5. When we asked this morning, the department wasn't sure how many 4-year-olds specifically were actually without access to childcare. Mr. Speaker, does the Minister of Education and Early Childhood Development find it acceptable that this budget offers nothing to those families struggling to find care for children from infancy to age 3?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. So the number that we had provided was for all preschool-age children who can access childcare supports in the province. The capacity for that is 25% of all those children. When you extrapolate the numbers to four-year-olds in full-time care, the number is actually reduced to 19%. And when you include part-time care, that number is actually still consistent with 25%, Mr. Speaker. That is the capacity issue that this government is committed to dealing with so that all children in our province have access to these programs, which we know will have a life-changing effect on many of them.
The Honourable Member for Dartmouth South.
Mr. Speaker, just for clarification, only 4-year-olds will have access to these programs. Mr. Speaker, there are thousands of children in this province who are under 4 years old. There are thousands of parents whose childcare needs don't end at 2:30, myself included, way after 2:30. There are many parents who have their names on wait lists for infant care before their children are born. The status quo is unacceptable, as we've all realized. Mr. Speaker, is the Minister satisfied with a budget that continues down the path of a lack of appropriate regulated childcare spaces and a patchwork of grants?
The Honourable Minister of Education.
Mr. Speaker, we recognize the capacity issue in the regulated childcare sector. We have a vested interest in their success as not-for-profits and as businesses. We invest in that sector to the tune of $55 million a year. part of our negotiations with the federal government and the dollars that we plan to receive from them is actually going to be to increase capacity of that sector, because we want all of our children of all ages preschool to have access to the best early child care possible in this province, Mr. Speaker, and pre-primary is absolutely key to that.
The honourable member for Sydney River Myra Lewisburg.
Thank you very much, Mr. Speaker. Mr. Speaker, my question through you is to the Minister of Health. Mr. Speaker, in August, the Health Authority took great pride in announcing that there were 16 new doctors coming to Cape Breton, families practice and specialists, and then 2 weeks later they had to announce that actually it was only 13 and write an apology and the letters to the editor that got hidden away in the paper. Today we know that 2 of those 13 doctors are not going to come. And they're both psychologists, Mr. Speaker. Psychiatrists. Everybody is hoping that there's a doctor somewhere available, Mr. Speaker. Mr. Speaker, what does the Minister of Health have to say to the people of Cape Breton about the fact that now we're 2 more psychologists short in an area that is in desperate need of help, after all the pride he took in announcing we were going to get them?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I'd like to correct the member opposite. I didn't make an announcement, Mr. Speaker, with respect to the recruitment back in August, Mr. Speaker. I believe there was a release that went out by the Nova Scotia Health Authority, Mr. Speaker.
Order, please. The Honourable Minister of Health.
With respect to the situation of the 2 psychiatrists, Mr. Speaker, that recently found out had accepted positions and changed their mind, Mr. Speaker, when I looked into that, the information that they provided to the Health Authority, Mr. Speaker, is that personal circumstances in their lives is the reason for choosing not to follow through with those positions, Mr. Speaker. I was in Cape Breton, met with the head psychiatrist at the facility, Mr. Speaker. They're doing great work, Mr. Speaker, and we're going to continue to work to fill those vacancies, Mr. Speaker.
The honourable member for Sydney River Myra Lewisburg.
Thank you very much, Mr. Speaker. Thank you. Doctors in Nova Scotia say that we're at least 3 psychiatrists short in Cape Breton Island. Yesterday, in a phone conversation, I talked to a mom whose son needed psychiatric help. Took him to the regional hospital at 5 after 7 and were told that psychiatric services were not available after 7 o'clock in the evening. This is the kind of a health authority that's being run. That minister is responsible for the operation of the health authority. My question to you, Mr. Speaker, through you to the minister is, when is he going to take serious steps to address the shortage of mental health services on the island of Cape Breton Island?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question. This is obviously a very important area when you're talking about mental health, Mr. Speaker. Yes, for his constituents and for the people of Cape Breton Island, but Mr. Speaker, I'd like to stress the fact that my interest and concern about improving mental health services is for all Nova Scotians, Mr. Speaker, from the Cape Breton Island down to Yarmouth,
Order,
Mr. Speaker.
Please. Order, please. The Honourable Minister of Health.
Mr. Speaker, as I was saying, the interest and the concerns that we have for providing mental health services for all Nova Scotians, Mr. Speaker, that's why in this budget, Mr. Speaker, we are providing over $6 million, Mr. Speaker, in additional funding for mental health service and addiction services, Mr. Speaker. That includes an additional $6 million, Mr. Speaker, from the budget that was tabled in April. Additional funds, additional commitments, additional professionals to provide these services to people across the province.
The Honourable Minister, member for Pictou Centre.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Health. 16 residents from Pictou County are currently receiving dialysis treatment. Approximately 50% of these residents receive treatment at the Sutherland Harris Memorial Hospital in Pictou. There's currently a wait list of 7 or 8 people needing this treatment at home. They must travel to Antigonish-Truro. In 2015, I asked the former minister to commit to increasing dialysis units in Pictou County. Yesterday's budget included new dialysis units in Bridgewater, Kentville, Digby, and Glace Bay. but none for Pictou County, Mr. Speaker. My question for the Minister, will the Minister provide this House an update on any additional dialysis chairs for Pictou County?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question. As his colleague raised similar questions about his community in Argyll-Barrington yesterday, Mr. Speaker, the same situation applies here. As he noted in his preamble in the question, we have committed to expand dialysis services in communities in this province. If you look closely at these situations, Mr. Speaker, where those areas where we've committed the funds, those residents are actually travelling much further than the residents, particularly in Pictou. The distance from
the Honourable Minister of Health.
The distance, Mr. Speaker, from Pictou to Antigonish, while certainly preference would be to have services as close to home as possible, Mr. Speaker. There are parts of the province where the services are much further apart, and those are the areas that we prioritise the investments.
The Honourable Member for Pictou Centre.
Thank you, Mr. Speaker. It is terribly inconvenient for residents having to travel outside Pictou County for this required treatment. Again, we talk about roads, Mr. Speaker. You're heading west, you're looking to Mount Tom, Kemp Town, and of course heading east, Barney's River. We know what those roads are like in the winter, and they have to go, storming or not, Mr. Speaker, for that treatment. So we have the safety concerns, road conditions, making 3 trips a week, Mr. Speaker, approximately 1.5 to 2 hours on the highway, 5-hour session at the hospital, Mr. Speaker, residents missing time from work, problems finding someone to travel with them so they have a safe trip back home. My question to the Minister, will the Minister commit today to increasing the number of dialysis chairs in Pictou County?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Again, as mentioned in the first question, of course, dialysis is a treatment, Mr. Speaker, that requires a significant amount of time. Receiving that treatment for most Nova Scotians needing the service, it takes place in a hospital, Mr. Speaker. And the additional time of travel, commuting is an additional burden, Mr. Speaker. Again, as a province, this government has committed to increasing investments to reduce the travel time. The approach that we've taken, Mr. Speaker, is to identify those communities with the furthest distance, try to bring those down. That's where our focus has been, our priority, Mr. Speaker. With respect to the highway, Mr. Speaker, and the travel time between Pictou and Antigonish, I'm very proud of this government commitment to twin that highway, Mr. Speaker, so that we improve that service going forward. Thank you.
The Honourable Member for Pictou East.
Thank you, Mr. Speaker. My question is for the Minister of Business. DSME was placed in receivership in February 2016, and since that time, PricewaterhouseCoopers has received close to $1 million in fees, and time is marching by. I just wonder if the Minister can update the House on the status of finding a buyer for that asset.
The Honourable Minister of Business.
Thank you, Mr. Speaker, and I do thank the member for the question. It's an important one for New Glasgow, for Pictou, and for all Nova Scotians with respect to economic development. And what I'm about to say isn't a partisan shot, it's a management of government shot. When the NDP were in power, they placed $60 million into this facility, and it was a business plan that had no market. So anyone that would understand the complexities of that industry, the wind turbine industry, would know they were destined to fail. So $60 million later, we've got a state-of-the-art facility with state-of-the-art tradespeople, great management, good teams all around, with nothing to do with that facility. So our challenge becomes, do we liquidate the assets or do we find a buyer? I want to assure the members from Pictou, I'm doing everything I can. We're holding this off as long as we possibly can, and I truly am confident that we'll find a buyer to revitalize and retrofit that plant and provide employment for the people in Pictou County.
The Honourable Member for Pictou West with no supplementary. The Honourable Member for Dartmouth North.
Mr. Speaker, as of November 2017, Nova Scotians living outside of Halifax will no longer have access to reading materials in alternative formats designed for people with print disabilities and vision loss. While the Halifax public libraries have secured access for their patrons, libraries outside of the capital have not. In the budget table on Tuesday, this government froze funding for libraries. I'd like to ask the Minister for Communities, Culture and Heritage if the budget tabled yesterday contains funding to reinstate access to CELA for all Nova Scotians in need.
The Honourable Minister of Communities, Culture and Heritage.
Thank you very much, Mr. Speaker. Until today, I was missing question period.
Order, please. The Honourable Minister of Communities, Culture and Heritage.
I would like to inform the member opposite and all the House and all Nova Scotians that as of October 1st, this service of CELA will be restored to the province.
The honourable member for Dartmouth North.
Mr. Speaker, I thank the member for this news, and I will relate it to the many people who have been contacting me with concerns about this service. Thank you.
The honourable member for Kings North.
Mr. Speaker, it's been almost a year since this government contracted Bright Star Canada to develop a long-term strategy for fixing rural internet. But their report, which was supposed to have been delivered in the spring, has not been delivered. When will we see that report of Bright Star delivered? My question is for the Minister of Business.
The Honourable Minister of Business.
Thank you, Mr. Speaker. A very important question for the member and for all the members here in the House with respect to internet access and broadband for all Nova Scotians, certainly in the rural areas that are underserved. The Bright Star, the work being done by Bright Star is partially complete. There is another component that they're working on now with some
time allotted for oral questions put by members to ministers has expired.